The topic today is teeth clenching and grinding. And I have the pleasure to have with me today Dr. Theodore Belfor, who has invented a revolutionary new device that will reduce that teeth clenching and grinding. Hello, Dr. Belfor, welcome. And why is it a revolutionary new device?
Well, traditionally, across the United States, if a patient is a teeth clencher or a teeth grinder, the dentist would provide a flat plane occlusal guard, which is nothing more than a piece of plastic that sits over the occlusal or biting surface of the teeth and protects the teeth. Now, the Chinese have a proverb which says, the poor doctor treats the symptom and the good doctor treats the cause. In this particular case, we're just treating the symptom, the grinding, and protecting the teeth.
What are the causes of teeth grinding and clenching?
Well, the two main causes for teeth grinding and teeth clenching are stress and a constriction in the airway. Let me explain. The constriction in the airway has to do with evolution. As we learn to speak, the tongue evolved down the throat, and every breath that we take must pass behind the tongue. If the tongue interferes with our airway, our brain, the hypothalamus, the conscious brain, the brain that's conscious of our autonomic nervous system, how we breathe, our heart rate, our body temperature, our pH, etc., that conscious brain perceives the constriction in our airway as a threat. It sends a signal to the master gland, the pituitary, which in turn sends a signal to the adrenal gland, and the result is the production of cortisol. Cortisol and stress are synonymous. So what I'm saying is that the tongue in the throat results in stress. The body perceives that as a danger, a threat to our survival, produces cortisol, and the result is stress.
How can the ortho block fix those problems?
The ortho block creates more room for the tongue. And when you bite on the unilateral bite block, which is a component of the ortho block, when you bite on that bite block, it contracts the base of the tongue and opens the airway. Furthermore, we show our patients how to bite on the bite block and bring their tongue forward through their teeth to their lips, which gets the tongue out of their throat, so that the appliance provides room for the tongue. It allows the patient to bring the tongue forward through the teeth to the lips and out of the throat. And the hypothalamus goes, ah. And when the hypothalamus relaxes, the cortisol is no longer produced. The stress is no longer produced.
How are you able to invent such a device?
Before that question, I'd like to say that the ortho block also provides a smaller surface. The only natural time that the teeth are in contact, that all our teeth are in contact, is when we swallow. Believe it or not, we don't consider the teeth in contact when we chew because there's food in between our teeth. So teeth grinding is considered a parafunction. A parafunction is detrimental to the body. So what happens when we teeth grind, we're bringing all our teeth together and provide a serious amount of force on those teeth. The unilateral bite block is in a small area, and the body's proprioceptive response limits the amount of force that we can put. So when you put the appliance in, you're immediately reducing teeth grinding by limiting the surface that we're biting on. And the body's response is to grind less. Now furthermore, for patients that are teeth clenchers and teeth grinders, their muscles are very tight. They have hypertonic musculature. Now traditionally in the profession, to deprogram those muscles or reduce that hypertonic musculature, we need to deprogram the muscles. That's always been done by allowing the patient to only hit on a few areas in the front with their front teeth. However, my position is nature designed us to do most of our really strong biting in the area of the second bicuspid and the first molar. Now that area, all our facial structure is designed. If you have a steak, you're not going to bite on it with your front teeth. What you're going to do is you're going to put that food in the bicuspid and molar region to be able to put force on it. So the unilateral bite block to deprogram that musculature is put in that area of the first bicuspid and first molar where the sutural system of the face was designed to cushion or shock absorb those forces. At the same time, the lower jaw is discluded. The teeth no longer touch, which allows the musculature to reposition the jaw in a muscular, comfortable, what we call centric relation. This is the relation where the muscles are most comfortable. So what we're doing is we're taking the tongue out of the throat and we're relaxing the musculature all at the same time. We're reducing stress and we're enhancing the airway. Now remember, we're enhancing the airway by physically taking the tongue out of the throat, but also by contracting the base of the tongue by biting on the bite block.
That's fascinating. How were you able to invent such a device?
Well, interestingly enough, about 12 years ago, I was treating performing artists. Performing artists cannot wear braces when they perform, and this was before Invisalign. So the goal was to straighten teeth for performing artists without using braces. We tried different types of appliances. The appliance that with a unilateral bite block was reported by the patients that were singers that they were hitting higher notes. Something was happening to their airway. And for the patients that were actors and actresses, something was happening to their face. They were reporting that their makeup artists would have to use different makeup or change their makeup procedure for every performance, that their faces were changing. So I stumbled on to the fact that a unilateral bite block produces craniofacial change.
You've seen those results. What other results have you seen, and how do you document those results?
Well, the documenting the results is what I've had to do because these results were not recognized. People questioned the validity. So I have to document the results extremely carefully. I use 3D MD Face, which is an 8-camera system that produces an accurate 3-dimensional replication of us, up to accurate to FDA approved and accurate to 250 microns. Those before and after photos can be registered in 3D space accurately. Furthermore, all my patients receive cone beam computerized tomographic scans. These CT scans, which are low radiation, give us a 3-dimensional look at the airway. And I use a software system that was developed by the Mayo Clinic, which allows us to do virtual endoscopy. I literally can send an eye down into the airway and look at the airway before and after. Very often we start with an inflamed airway, a contracted and constricted inflamed airway, and the after photos show a reduction in the inflammation and an opening of the airway.
Who do you recommend wear this device, Dr. Belfor?
Anybody that has enough teeth, that's a teeth grinder or a teeth clencher, and the teeth are solid and not periodontally involved, and pretty much above the age of 12, so that their dental arch is stable, are candidates for the Ortho block.
And where can someone get the Ortho block?
Any dentist can provide the Ortho block. When a dentist takes an upper model, an impression to provide an upper model for the laboratory, all he must tell the laboratory is that he would like an Ortho block appliance, and he must indicate which side of the patient's face is less developed. Now that's the side with a lower eyebrow, smaller eye, deeper nasolabial depression, thinner lip, deeper prejowl region. Any of these can indicate a less developed side. The dentist must recognize that and write Ortho block left side or Ortho block right side.
Does the dentist need to be an orthodontist in order
The
to...
dentist does not need to be an orthodontist. And by the way, if the dentist puts the Ortho block on the wrong side, the appliance still works. It's just not as efficient.
Is there any special training that the dentist needs?
The appliance will come with a brochure that gives the dentist all the information that he or she would need to be able to provide this appliance for their patient.
So what I'm understanding with this fascinating device is it reduces stress, more air to your organs, better sleep, and kind of a facelift.
Well, it's not exactly a facelift. However, the external body is programmed for symmetry, and what we're capable of doing is provide an epigenetic response. Epigenetics is a very big thing today. And what we mean by that is, by biting on the bite block, destabilizing that craniofacial system, we get an expression of genes that have never been expressed before. And since we're programmed for external facial symmetry, what happens is the body generates additional bone and more facial symmetry. That's done by mechanotransduction, generating bone development. What I mean is that the appliance provides a mechanical force on the periosteal membrane, which has mechanoreceptors in it. The result is a bone cell response. Mechanotransduction is a mechanical force that produces or elicits a bone cell response. In this case, the bone cell response is reproduction of additional or production of additional bone or bone growth. So the unilateral bite block, when worn, contracts the base of the tongue, strains the periosteum, produces mechanotransduction, which generates bone cell development. The result is face and airway development.
Thank you so much, Dr. Belfor. This has been absolutely fascinating, and I'm sure the Ortho Block will help a lot of people who suffer from the teeth clenching and grinding. Good luck to you, Dr. Belfor.
Any dentist can provide an orthoblock appliance for his or her patient. A full upper model is generated from a good impression material and sent to a certified laboratory. An orthoblock appliance is requested. The only responsibility of the dentist would be to indicate right or left side for the bite block. That's determined by which side of the patient's face is less developed. For Lori, the upper lip is a bit thinner on the left side, and we've chosen the bite block to be on her left side. We look at the level of the eyes. If the eye were lower on the left, or the eye smaller on the left, or the nasolabial depression deeper on the left, or the prejowl region deeper, any of these are an indication for which is the underdeveloped side. To deliver the appliance, we place the Hawley arch wire up against the front teeth, hold it in place with one hand, we press the bite block into position with the other hand, and snaps right into place. Then swap hands and be sure that the Adam's clasp on the opposite side is also secure. This appliance is now quite secure in the mouth. And when the patient bites, bite down, there is now enough room for her tongue to actually come forward through her teeth to her lips. So Lori, bring your lips together gently. And what we're going to do is we're going to ask the patient to breathe in deeply and to hold it for a count of 5 or 7. And then breathe out completely, getting all the air out of your lungs. So we're biting on the bite block. The tongue is forward through the teeth to the lips. The lips are firmly sealed. And the patient breathes in deeply to a count of 5 or 7, and holds it for a count of 5 or 7, and then breathes all the air out of his or her lungs. This is controlled breathing. What we're doing is taking the tongue out of the throat. By biting on the bite block, we're contracting the base of the tongue, and by controlling the breathing, we are signaling the hypothalamus, and the hypothalamus goes ah. The tongue is out of the throat, the airway is patent and open, the patient relaxes, and less cortisol is produced. When you deliver your appliance, if the appliance is not tight enough, a 3-pronged plier may be used to adjust the Adams clasp by just rotating your wrist. On the opposite side, we can take a bird beak plier and adjust the Adams clasp on that side by simply rotating your wrist.